By end of October, we should have 3,700 CTF beds, and that will complement hospital beds. Next tier will be CCFs, community care facilities, and these are to house those who are actually well, but for various reasons need to be isolated from the rest of the family. And we have 4,300 CCF beds now. And finally, the last tier is actually our own homes through the home recovery program. Because of our high vaccination rates, over 98% of infected individuals are actually well with no symptoms or mild symptoms. And so the best way for them is to recover at home, which is safe for them, safe for their family, and safe for the community. A lot of work, a lot of resources, commitment have been devoted to resolve all the teething issues that was encountered. So we can now onboard almost all new cases every day, quite smoothly. Helpline resources are being beefed up to enable those who need to contact us to do so. This is an area that we are still improving. We are aware that many patients on home recovery tried to call but couldn't call through. So this is an area that we are immediately beefing up resources on. We have also ramped up our telemedicine services by bringing on more providers, including our primary care providers in the community. While they have been very busy, they so far have been able to cope because almost all patients on HRP are well and do not actually need to call the telemedicine doctors frequently. From 1st of October, we are also working with the People's Association to provide ground support to individuals who are on home recovery program. There are still many improvements to be made, including to scale up the program to handle more cases. And SAF and MOH are actively working on these measures. All these changes I mentioned earlier are to prepare ourselves to handle the next doubling cycle, which will potentially be 3,200 local community cases, and beyond that, perhaps even 5,000 cases. A major challenge besides the physical facilities is the need to find and deploy doctors, nurses, and medical teams to run these facilities. And this is actually even more challenging. So I'd like to make a call out to our general practitioners and nurses out there to help us man and run some of these facilities. And for doctors to help join the telemedicine team to help take care of those on home recovery program. So if you are available to help us, we welcome you into the Volunteer SG Healthcare Corps. I will put out the details on how to volunteer through social media.